Good Monday afternoon, and thanks for joining us. I'm Charity Menifee, the Director of Communicable and Environmental Disease and Emergency Preparedness at Knox County Health Department. Our moment of gratitude today is dedicated to the many folks in our community who practice the 5 core principles that we have outlined in our plan while they frequented restaurants and retail businesses over the weekend. Anecdotally, we've heard positive stories about people continuing to wear masks and observe physical distancing guidelines in these situations. This is our new normal, and we are urging people to continue to be vigilant to slow the spread of disease. So thank you for all that you are doing. On Friday, I did a rundown of the resources that are now available on our website, including the benchmarks outlined in our reopening plan and some of the metrics that we utilize to evaluate attainment. We want to stress again that decisions to move from one phase to the next aren't based on just one number or figure. We look at the whole situation, the entire picture, evaluating multiple data points and trends while utilizing our public health expertise and experience in consultation with our county and city leadership. Consider this analogy. When you aren't feeling well, you go to the doctor, they interview about your symptoms and maybe do a few tests. Additionally, they then use their clinical training and judgment to make a diagnosis and determine the best way forward for you as a patient. And we're doing the same thing in public health. We're using our metrics, which are like the test, and our health expertise and experience. We are happy to provide information and answer additional questions during this format. But there's more metrics and there's more information that simply can't be virtually represented on a website. And we tried to explain that in the plan. There's a lot to these decisions that we're making. So with that said, we know we're getting a lot of questions on how the data and metrics are being interpreted and those types of things. And there will be more information coming out later today to all of you guys in the media on how you can ask those questions and how we can get answers back to you. So there'll be more coming on that. We know you want to get into those nuances, but we're just not sure that this is the best environment to do that. And I'm probably not the best person to provide that. And it's just very, very detailed and very complicated to explain. And we want to get you the best answers that you can get in a different way. With our benchmarks and the traffic light visuals on our website, know that we're trying to provide answers and information to 2 groups of people. There's the people that are data lovers and that love all the detail and want to see it. And we hope that's available and we use that for them, what's on our website. So all of the different metrics and all of the data that we provide daily and our benchmarks. But we also did get a lot of asks from people who were on the other end of the spectrum who just really wanted a more simplified assessment of how we're doing. And that's where the red lights came in. And again, using kind of that same metaphor that we use with the doctor. So taking all the data and our opinion and putting that into that metric, those traffic light signals. And that's just to explain how we're doing. So moving into our local situation. We have 246 confirmed cases of COVID-19 in Knox County. That is 2 less than we reported from yesterday. So as a reminder, again, like we've been explaining, the state gets all of the reports in and those reports come to us. And then we do our investigation here on the local level. And when we need to, we transfer them out of our jurisdiction when we find out that they don't live in Knox County, the cases. And that was the case that we saw this weekend and why you saw 2 cases drop off today. So our team's doing a great job with those interviews and following up with cases quickly. We have 209 of those 246 cases have recovered. 35 individuals have been hospitalized at some point in their illness, with 2 currently being hospitalized. And we are thankful to report that we have no additional death due to COVID or complications from COVID-19. The Knox County Health Department will continue testing this week, Monday through Thursday. In order to reduce wait times, we're asking folks to call our public information line at 865-215-5555. Again, that's 865-215-5555. People will be given a window of time to arrive for their testing. Once again, this is just to reduce the wait times. This testing is still being done through a drive-in model, and we are still encouraging folks that want to get tested to call their primary care provider first. However, For those whose providers aren't testing, please call our information line and we'll get you tested through the health department. We, along with the state, continue to look at how to expand testing while being strategic and targeted in order to reach people in need and at high risk of complications. Additionally, testing is also much larger than just public health and mass testing events. Testing continues to be available at doctors' offices, urgent care centers, walk-in clinics, and our area hospitals. And we want to continue to see that increase, and that's one of the metrics that we're looking at. We mean it in all of these settings when we talk about increased testing, not just public health. And with that said, we'll open it up for questions now.
Please go ahead and submit questions into the chat feature. All right, from WVLT, they say they asked on Friday and KCHD didn't have the data at the time, but what is the number of COVID-19 patients that have recovered after being placed on a ventilator?
Oh, I still didn't go back and get that. And I'm not sure if that's data that we'll be putting out widely. I do know that we have had patients that have been on a ventilator and recovered, but I still don't have that information to report today. We'll take a note of it though.
From WBIR, we all observed people not wearing masks this weekend like they should be. Did your employees at the health department see the same thing? What do they think of it? And what would the health department say to someone who says a mask is infringing on their freedom?
You know, we heard anecdotal both ends of the spectrum. We heard a lot of people who went out that said they saw people that were doing exactly what we've been asking. And we did hear some cases where folks weren't. We want to go back to the reason behind wearing the mask. It's to protect each other in this situation for people who may have the disease and not know it and can be spreading it. So we still encourage people to please wear masks and wash your hands and stay 6 feet away. We always put these measures in our public's hands, and for the most part, people continue to do what they're supposed to do. And so we ask that you continue to do that as you move forward, because this isn't over. And the more that people cooperate and continue to do what we're asking, hopefully that curve will stay flat and we can continue to move through these phases. And that's what we need to have happen in this situation. A lot of people not doing that and a lot of spread of disease and people congregating, we may have to revisit where we are as we move forward.
From the Sentinel, you've said you were going to make an epidemiologist available to answer technical questions about your benchmarks. So far, you have not done so either in private or press conferences.
Yep.
When will that person be available?
That's what I just said. So we are going to make the epidemiologist available. You'll get the plan on how we're going to do that. That's just in a better format so you can get all the questions that you need asked and answered in the way that you want them answered. And we're working on that plan today, and you'll get it later today.
From WBIR, there were several families who were out this weekend. We get that people are anxious to get out, but is it advisable to take the whole family with you?
We still don't recommend you take the whole family with you. We do know that people are tired of being in the house, and maybe that's a good time to go to the park together and go for a walk. But in those congregate settings where people can get together and mix germs, we really don't recommend it at this time. Again, we're still dipping our toe in the water here as we start to expand what services are out there and open. And we really want to do it slowly and thoughtfully.
From WATE, how many complaints came in about not following the guidelines since Friday? Have new warnings or citations been issued?
I don't have that number in front of me, but I know the staff's following up with those.
From WBIR, are you happy with the amount of people who went out this weekend, or do you think people are being irresponsible?
You know, I don't know. I wasn't out in large crowds a lot this weekend. I went to one place. And so I think overall, and what we always see in public health is most people try to do the right thing and do things to protect themselves. And we just ask that people continue to do that.
From the Sentinel, when can we expect COVID-like illnesses to be reported on the county website? What is your timeline?
So we're working on that. I think I talked about it Friday, and Dr. Buchanan mentioned it in some one-on-one interviews as well. There's an issue with our website and how we can show that information on our website and still be ADA compliant. So we're looking into it and we're still working on it. I don't know when that will be ready yet. But also I want to point back to that's not one of our benchmarks. So there's lots of different things that we can look at, and all of our benchmarks that we talk about in our plan and all of our other daily information is still out there. So just keep that in mind as well, please.
Also from the Sentinel, what are the counties that you've included in your healthcare capacity metric? You say that you're covering 16 counties. What are they?
So I will mess up if I name them. I try to name them, but it's the 15 counties that surround Knox County. And if you look at, trying to think, I believe the Tennessee Department of Health has the public health regions identified on their website, and ours would be the Knox and East regions counties.
From WBIR, we've seen where state leaders in Utah, and surely there are others, warning about their inevitable second wave around September. Is Knoxville prepping for one? Can we prevent a second wave? And do you foresee another lockdown?
Those are three questions. Okay, so first of all, we expect there to be waves. There typically are with these types of illnesses that circulate around the world. Exactly when ours will be, we don't really know. But again, all of the things that we're doing to try to slow the spread, all of those 5 core principles that we talk about will help to slow the spread of disease in our community and hopefully help us be better prepared for when other waves come in. And then what was the last bit?
The last one was, do you foresee another lockdown this year?
Again, everything is open to looking at what our data and our local situation is showing, and then talking with our officials on the city and county side to make those determinations. I hope not, but I think we have to wait and see where we are.
From WATE, the State Department of Corrections is dealing with outbreaks at prisons. Has the county's inmate population been tested?
I know that we talk with the Sheriff's Department frequently, and I would want to refer you to them for all of the specifics, but I do know that they've tested folks when there's been need, if there were symptoms or anything like that. And we still don't have any positive cases out of the jail at this time. And we are waiting on more guidance from the governor's office and from the state on how to move forward with corrections testing as well.
From WVLT, can you send out the number of complaints from the week later today?
Are we doing that? I'm asking. Yes, we can.
From WBIR, can you reiterate and help us understand why wearing a mask is important? Does it protect you or people around you?
It protects the people around you, but me wearing my mask protects you, and you wearing your mask protects me. So it's a team effort in this. And so we really want everybody as much as possible to be wearing them, but it's preventing the spread of my germs to other people.
From WATE, also with prisons, we've seen a high proportion of asymptomatic cases. Does that suggest many members of our community may be asymptomatic carriers?
Well, I think the evidence shows that there are asymptomatic people that can transmit the disease, and there's more and more information coming out about that, which kind of goes back to those 5 core principles and trying to continue social distancing as much as we can in these times. We say to treat everybody like they could be potentially infectious. And so I think that's something that's important, and that's what's being looked at and considered as we're waiting on our guidance to move forward with the corrections setting as well and other areas.
From the Sentinel, in the increased or sustained testing metric, we are currently listed as green. This metric does not appear to take into account the low levels of testing seen previously, only the increase. Can you please explain this metric? Is it literally just the increase in tests over time?
Yeah, I mean, and again, we'll be getting more information, and you can talk to our epidemiologist who's working on all of this data, and we'll figure out, you'll be able to get questions to them and we'll get answers to you on this. But it is looking at increased testing over time, and it's based on where we are right now. And we have been continuing to see testing grow. And there are limitations listed on the website as well about the testing information that we have.
Any other questions, please submit them. From WATE, have you given any guidance to schools when it comes to planning for social distancing for school resuming in the fall?
We haven't gotten there yet. We've been really focused on trying to get through this phase 1 of reopening and moving forward into that. And so we talk to the schools regularly, and we will continue to do so. And I'm sure we'll talk with them on their plans, but we haven't at this point.
From WVLT, is Knox County and Tennessee going to herd immunity?
I think that one's really difficult at this point. There's certain percentages that you need to be at, and it's how many people have had it in the community and all of those things. Do we want to get to that point? Do we hope we get to that point at some point down the road? Yes, but the exact information on it, I don't have that right now. We are trying to slow the spread. We don't want to get to herd immunity too quickly, because that can mean that our hospitals and healthcare systems get overwhelmed very quickly. And so again, everything we're doing right now is to keep keep us moving in a flat trajectory as much as possible, so that we can continue moving forward through the opening.
From the Sentinel, the health department has been asked several times for the county's effective transmission rate. Where is it and what is it?
Where it's not one of the measures we're using. We've talked about this. There's a lot of variables that go into that information. It's not one of our benchmarks. You have a lot of data on our website that we're utilizing to make these decisions, and that, along with models and those types of things, they're not the benchmarks that we're using as we move forward.
From WATE, any plans for another remote location mass testing event like the one at the convention center?
Right now, both the state and Knox County Health Department, we're looking at more targeted venues for testing, and I'm working on plans for that this week and waiting for some guidance from the state on that as well. So we make sure that we're not doing things dramatically different from them. To be honest, in the state's huge testing events and in ours, we just haven't seen a lot of positives come out of those. And so we want to be very strategic. Positive cases, sorry. I'm sorry. Thank you. We haven't seen a lot of positive cases. So, out of over 500 we tested one day, I think we had 6 positives. One person had already been positive, so 5 new cases. And so we really want to make strategic decisions and make sure that we're getting to people that are at need and at high risk for complications, and working with the state on how to do that moving forward.
From the Compass, on Friday, Dr. Buchanan's order covered close contact personal service businesses. Will she issue an order that includes all of the guidelines? If so, when should we expect it?
We're going to have to see. Did the additional order go out Friday? Because
yes, there was an amendment to the order that went out Friday. If you didn't receive it, we'll be happy to resend it.
So there was an additional amendment that went out, like Kelsey said, and we'll make sure that you get it if you didn't see it. But that was meant to extend us through this next phase.
Any other questions? Please go ahead and submit them. From the Sentinel, the red and yellow statuses are nebulously defined. How are we to evaluate these as benchmarks when there appears to be no hard trigger for a policy change or clear definitions? So
that goes back to what I was talking about. So we have our 2 groups of people who want all the data, and the people who wanted some more simplified, how are we doing measures. So there's lots of data on the website, all the daily reporting that we have available, and then the weekly reports of the benchmarks that we've picked are on the website. And then there's the traffic lights, which is really meant to be pulling all of that together and using our impression of how we're doing in those metrics. And we've said that in the plan. We've said that when we put the metrics and the information on our website, very similar to the thing I just explained of when you go to your doctor's office, that there is some judgment in there, and that's what we're utilizing as we move forward. But with that said, again, on what the actual numbers are that will tell us if we've grown or if we should be concerned, there are mathematical, statistical formulas that are used. They're part of the similar methods that we use for our syndromic surveillance, which are nationally used methodologies. And again, we will give you a way to get information from our epidemiologist on exactly what that is moving forward. But it is a lot for me to explain in this setting right now. There's a lot of information there.
From WATE, is 311 still the best number for people to call with concerns about a given business following the guidelines?
Yes, 311 is, and we are so grateful and appreciative of them for what they're doing and stepping up to help take this on, and they're doing a great job. So yes, please call 311 with those concerns.
Their secondary question is, what happens when that call comes in?
And if not, it will be sent to subject matter experts for different sectors, or if it's a regulatory situation for businesses that we regulate in any type of way, those would come to us for follow-up as well. So there's different groups that could be following up that were part of the planning process for this.
From WBLT, with current testing, will it take 2 weeks to see any spikes after reopening?
Yeah, our testing time frame has gotten better on getting results back, as you can see on our website, but it's actually more about incubation time. And that's where that 2-week window comes in, because that's still kind of the long end for people to start showing up with symptoms. So 2 weeks is probably a good gauge to look. And that's the other reason that we have a full 28 days in each phase, because we want to go through 2 of those incubation periods to really be able to have a good idea of where we are in the community and how our measures are affecting the local data.
Any other questions? Please submit them now. All right. Well, thank you all for joining us today. We appreciate you logging in, and we will see you tomorrow at 12:30. Have a great rest of your day.
Thank you.